Thank you so much to everyone for joining tonight. I know it's been a interesting past month, and I hope that everyone out there is staying healthy. I hope everyone's family is doing well, and I hope that you enjoy our talk tonight. Our goal is to kind of supply you guys with more and more content, more and more information, so you can take your health into your own hands. So today's big topic is going to be how to lower inflammation to boost your immune system, right? Immune system is a big buzz term with everything going on with the coronavirus and COVID. And, now's the time where everyone wants to kind of know what can they do for their immune system. I'm going to talk heavily on inflammation and how that affects the immune system, and really a lot of simple and honestly free things that you can do today and tomorrow and start integrating them into your life to lower inflammation, right? And overall improve how you respond to infections and all sorts of different things. Some of you might have joined my talk that I gave 2 weeks ago on the immune system and how to boost your immune system. We went really in deep in how the immune system works and different ways to support it. And we touched a little bit on inflammation, but I want tonight's talk to go a little bit deeper into inflammation because I think it's really key and it's really important in allowing your immune system to work how it should be. Right? Our immune system is such a complex system with so many intricate moving parts that we want to just give it the tools so it can function the way it wants. Right? And that's what we're going to talk about. The importance of lowering inflammation is to allow our immune system to respond to, let's say, a pathogen appropriately. And so that that pathogen doesn't lead to more serious illness, right? And we'll talk a little bit, but that's what we're seeing largely with the coronavirus and COVID, is that it is creating this inflammatory storm or this cytokine storm. So individuals are getting sick, and then they're getting this crazy surge of inflammation that unfortunately is leading to death and more serious complications. So that's what we're going to talk about. How do you have an appropriate immune response where you have inflammation and then you resolve it? Right. So for those of you who don't know me, I'm Dr. Perry Maynard. I am one of the lead clinicians at Integrated Health Systems here in Denver, Colorado, or we're just south of Denver. So a little bit about me. I am a board certified chiropractic neurologist. So I have my diplomate in clinical neuroscience. I have training in immunology, rehabilitation of traumatic brain injuries, and inner ear rehab. So a majority of the patients I see are concussions, patients suffering from inner ear disorders, patients suffering from autoimmune disease, neuroautoimmune diseases, things like MS, different things like that. So we try to create an integrative approach of not only brain rehab, but approaching one's metabolic system, right? Saying, what does their inflammation look like? What does their thyroid look like? What do their hormones look like? And how do these all influence one's ability to recover from, say, a head injury, or let's say an infection or things like that. So inflammation, right? What is inflammation? Everyone talks about it being related to so many disorders, right? You'll see some research, you'll hear some individuals say that, 80% of diseases are related to inflammation, right? Everything from cardiovascular disease and asthma, to infections, to obesity, to cancer, you name it, inflammation plays a role, right? But what is inflammation, right? We talk about it and we throw the term around pretty freely and we just say inflammation, lower inflammation, but what is it, right? I'm going to give you a brief kind of description, kind of from an immunology point of view of what really is inflammation. Because the better we can understand mechanisms behind inflammation, we can understand where in the inflammatory process is someone stuck. And once we figure that out, we can find what is going to be the appropriate kind of input to give that patient to stop that inflammation. Once again, things like turmeric or resveratrol may be great for some, others it may not be great. Some fish oil or different things may be great, others that might not be so great. Right? So when we look at inflammation, so largely, so before we get to the slide, let's talk a little bit about the immune system and inflammation. So I want you to think of inflammation in this light. Think of a sink, okay? The sink and the actual sink component, think of that as the tissue, whether that tissue is the thyroid, whether it's your ankle, whether it's your brain, whatever it may be, right? And the faucet is going to be your vein, right? Or your vascular system, okay? And then below that sink is the drain, and that drain is your lymph system. Some of you may be familiar with your lymph system, right? It's the system that moves immune cells out of tissue, right? When all of us get sick, right, we get swollen lymph nodes because we're moving pathogens and debris into those lymph nodes to pretty much present them to the immune system. Right, so going back to the analogy, if we think about the tissue, right, so that sink, in that tissue, you have certain immune cells that are constantly detecting the state of that tissue. And then in the bloodstream, you have all sorts of immune cells, but most specifically, you have two different immune cells, one called a neutrophil, the other called a monocyte. For those of you who have had a CBC run, you would have seen neutrophils and monocytes on there, right? So they're a form of white blood cell. And let's say the tissue all of a sudden recognizes something's not right in the tissue, right? It produces certain chemical signals, or what are called cytokines, to signal inflammation is needed. There is something in this tissue that is not normal. We need the immune system to come see what's going on. These things are things like TNF alpha, NF kappa B. Once again, these may be very not familiar words to a lot of people, but those are signaling molecules, or what are called cytokines. So it's a way your immune system signals to say, hey, we need help, right? And as we'll talk about, things like TNF alpha, NF kappa B, things like that, they're talked about heavily as being bad things, but they're very needed. The problem is when they get out of control and other things are causing signaling of those things when there's really not an emergency, right? So we release these inflammatory signals. This causes neutrophils to start pouring out of the faucet into the sink, or out of the vein and into the tissue. That neutrophil then recognizes different patterns, and we'll talk about these in just a sec. But it recognizes either damaged tissue, pathogens, or other alterations in the tissue and says, I need to approach this, right? And then that neutrophil comes in and engulfs, let's say, that pathogen. And then when it engulfs it, it needs to then send out more inflammatory chemicals to have what are called monocytes come in. When monocytes come into that sink from the faucet, they help to get rid of that neutrophil and bring it into the lymph system to clear out, right? If this process happens in a timely manner, things go well. The problem is when this system does not resolve, right, that's where we lead to further tissue damage. So those neutrophils think of a timer on them, that in about 6 to 10 hours, they are going to go through what's called apoptosis, or cell program death. So they're going to die. If this doesn't happen, or the damage is so bad in the tissue, you can start getting what's called secondary necrosis, or more tissue damage. And this is kind of what you're seeing in things like COVID, is that there's so much damage occurring in the lungs, and one individual may not be able to clear it quick enough, that you get signaling of more and more inflammation. So what happens is if those neutrophils don't get out in time, they cause more damage, which then signals more inflammatory mediators to then bring in more immune cells, right? This is where you see swelling in your ankle if you sprain your ankle, or swelling in tissues, redness in tissue, is that inflammation, right? So what are the three big things that the immune system is looking for? This is really important because this is how we're going to think about treating one's inflammation. We have what are called DAMPs, PAMPs, and HAMPs. Okay, kind of funny words. DAMPs stand for damage-associated molecular patterns. PAMPs stand for pathogen-associated molecular patterns, right? What those big fancy words pretty much mean is damage-associated molecular pattern. It means that when tissue gets damaged, it gives off a certain molecular pattern, or a sequence. And your immune system recognizes, and it has the ability to say, that's damaged tissue. You just rolled your ankle and your tendon is a little bit damaged. That's a DAMP. And that signals the immune system to come in to heal that tissue. And then you have what's called a PAM, or pathogen-associated molecular pattern. Pathogens or infections have certain patterns on them, so your immune system can say that's a virus, that's a bacteria, that's coronavirus, that's strep, or that's Lyme, whatever it may be. it should be able to recognize the pathogen and then have an appropriate response. This is what's really interesting is you also have what are called HAMPs, or homeostatic altering molecular processes. And this is really interesting from the standpoint of the research shows that there doesn't necessarily need to be damaged tissue or a pathogen. Any imbalance in a cell can signal inflammation. We'll talk about this a little bit more when we get into some triggers. This means alterations in blood sugar, alterations in sleep, alterations in electrolyte balances. Pretty much anything that isn't optimal in the body can signal the immune system to create inflammation. Once again, inflammation is important, but we want to make sure we're not sounding the alarm too much. We don't want to be the boy who cries wolf and saying there's always a threat here when there's not, because that's going to put us in this higher state of inflammation so that if something does happen, like an infection, we may not be able to respond how we like. Or it may set us up for something like an autoimmune disorder after that occurs. Or once again, these are the patients I see where you have individuals who hit their head and they respond really well. And then you have other ones where they bump their head and they are wrecked for an entire year. And you start to say, what's going on from an immune standpoint, right? And that's why it's important to do everything in your life to try to get yourself at that low inflammatory state so that if God forbid something happens, right, you can have an appropriate inflammatory response and you're not always kind of on both ends. Okay. So what are some signs of inflammation? How one might know that they have inflammation without getting tested? Well, from a structural standpoint, people with chronic injuries, maybe people with tendonitis. So maybe my elbow always hurts. My knees always hurt. My low back's always in pain. I work out and it takes me weeks to recover, or hey, I go to lift and I just can't respond how I used to. My knees are always really, really sore, right? You're looking at an inflammatory response that you can't end, right? Inflammation is appropriate after workout, but you need to then be able to quell that inflammation after you repair that damaged tissue. So those can be signs of chronic inflammation. In the brain fog, mood disorders, things like depression, anxiety, memory issues, different things like that can sometimes be signs where the brain may have some sort of low-grade inflammation, either from a past infection, chronic stress, multiple head injuries, whatever it may be. Autoimmunity. Autoimmunity is a huge sign of inflammation. If there is an autoimmune disease present, there is issues with inflammation. They come hand in hand together. And then from an immune standpoint, these are people who may not be able to fully resolve infections. So these could be the individuals that say, when I get sick, it takes me months to get over it. I've had this cough for months. I can't seem to get rid of it, or it takes me a while to really fight these infections. You're looking at an immune response that wasn't fully able to resolve, right? And you just have this low-grade inflammation and tissue damage that's going on, right? You should be able to fight something and then recover relatively quickly. And then things like allergy and asthma. Allergy and asthma in some of the literature are very associated with immune dysfunction and chronic inflammation. And for those of you who listened to my last webinar on the immune system, we talked heavily on the different arms of the immune system and how they play a role with allergies and asthma. So once again, you can start seeing, these are all different signs of inflammation. And it's really cool because your body will tell you how you're doing. You may start some of these protocols that I'm talking about and say, wow, I'm bouncing back from workouts better than I ever have. My brain fog is better, or I'm able to fight infections better. You can use these all as indicators of, are the things that you're doing working? Right? So you don't always need to run out and get a ton of lab work and things like that. Listening to your body is key. Okay. So this is going to be a really cool picture I want to go through as it relates to inflammation, right? So some of you who joined me last week or 2 weeks ago, we talked about this a ton in the lecture. So we're going to talk about different mechanisms behind inflammation because it's going to make sense when we go more in depth about different treatments, things like that. I just saw someone saying that they're having trouble with sound. Can everyone give me a thumbs up or thumbs down if they're having trouble with sound? I want to make sure that I get that address so I don't go through this whole presentation and no one hears. Um, Perfect. So it looks like I'm getting some thumbs up in regards to sound. Perfect. So it looks like people are hearing. So we'll continue. So this is a really cool picture, right? And this is looking at how one cell produces inflammation. Now, I know it looks like a very complicated cell, so don't get too hung up on the pictures. We'll kind of walk through the important parts of this. But this is looking at how the body produces what is called um, an inflammasome. So an inflammasome, in essence, is largely what is produced by the immune system to help fight infections. And this is kind of important when it comes to, COVID and coronavirus and things like that, is that they're starting to look at the inflammasome and more specifically what's called the NLRP3 inflammasome and its role in the excessive immune responses that individuals are getting with illness. So if we look at and say, okay, what are the things that cause an increased production of inflammation? And then what are things that slow that down? Right. So the important thing to look at this picture is where you see where it says acetylated alpha tubulin, right? So the key in the way the body works in a lot of ways is different mechanisms, right? You take one piece off of a molecule and it means it's going to do totally different things. Maybe you put on a different molecule on another molecule and then it totally changes the fate of everything. So we can see that when that alpha tubulin has an acetyl group, it goes one direction into inflammation. When it doesn't have that acetyl group on it, it goes towards an anti-inflammatory direction. So then we have to say, what are the things that are going to cause that acetyl group to be placed on that molecule or taken away from that molecule, right? A big gene that we have to look at is what's called our sirtuin gene. So some of you may be familiar with who are kind of interested in the anti-aging world and things like that. But sirtuin genes are really interesting because they are discussed a lot in anti-aging, in longevity, and things in regards to that. Oh, sorry. Um, so when we look at the sirtuin gene, we have to look at what are the things that kind of inhibit its function and what are the things that activate its function. So when we look at that sirtuin gene, you will see different arrows. So pointing at the arrow with the blunt sign, we see what's ROS, or what's called reactive oxygen species, potassium efflux, which is pretty much imbalance in electrolytes, a low pH or more of acidic environment, and then what's called less NAD, which is pretty much your cell's ability to have energy. That's what NAD is. When we look at the preceding picture, we see metabolic stress, so blood sugar issues, fatty acid issues, cholesterol issues. All of these things are going to lead to inhibition of this SIRT2 gene, which is then going to lead to inflammation and production of that inflammasome we're talking about. So this makes sense when we look at some of the current situation with some of the patients not doing well. A lot of them have comorbidities. They have diabetes. They have heart disease, right? So they're having signals that are inhibiting that SIRT2 gene, which is leading to more and more inflammation being produced. So then we have to look and see, what are the things that activate that sirtuin gene, right? What are the things that are going to stimulate that, right, and help us to not create nearly as much inflammation? And some of those things we'll talk about a little bit later on. There's certain supplements, there's certain eating regimens, there's all sorts of different ways that we can target that gene and shift inflammation into a beneficial way. So one first big thing I want you to think about with inflammation is think about what are called inflammasomes, and then think about what's called your sirtuin genes, right? Or your SIRT2 gene. That's going to be a very important gene when it comes to inflammation. Okay. Oh, don't. Another important thing that we want to look at is one's ability to resolve inflammation. So as I said earlier, remember, we have inflammation that occurs. We need to fight the infection or we need to heal the tissue, whatever it may be, bring nutrients to the tissue. But then once that's successful, we then need to have a resolution of that event. So if we look at this graph and we look at the green, we see onset phase, pro-inflammatory, and then we see resolution phase, pro-resolving mediators. So we get sick, we hurt our ankle, we get inflammation, we get a little sore, and then we resolve the situation. The problem is when we get a runaway of inflammation, right? So in this case, we're going to talk about what are the things that help in resolving inflammation. So we know that excessive tissue damage will cause inflammation. So once again, you have a hurt knee and you continue to lift on it and live through pain and give it more and more damage, that's going to cause more inflammation, right? Or you have more production of inflammatory signals like TNF alpha or NF kappa B for whatever reason, that's going to signal more of that onset phase. We want to have a balance between the onset phase and the resolution phase. So, what are some things that help produce what are called resolvins or resolving factors? And one of the big things is something that a lot of you are probably familiar with, and that's fish oil, right? EPA and DHA. So when we look at fish oil and people talk about it being anti-inflammatory, this is a large reason why it's anti-inflammatory. It helps to resolve inflammation so that as you sprain your ankle, as you get an infection, whatever it may be, and you get this onset of inflammation, you need to produce what are called resolvins. Resolvins are chemical mediators to say, everything's good, we're done, let's quell inflammation and let's get on with our life. So if we see imbalances in, EPA and DHA or omega-3 or omega-6 or omega-9 ratios, this is where you may see someone gets inflamed. They don't have enough EPA or DHA to have resolution, and on goes inflammation. This is why a lot of people tout and talk about how fish oil helped them so much in everywhere from the athletic world to the brain injury world, all those things. But this is how it fits in. And we need to understand with each individual, is there an issue in resolving inflammation? Because if so, EPA and DHA are going to be great. If that's not the case, someone may take it and it may not do anything for them because that may not be the problem. But this is an important phase we want to look at is, can you resolve inflammation? So first thing we look at is the SIRT2 gene in the production of inflammasomes. So we got to see, what is the system that creates inflammasomes, right? We want them, we want a balance. And then we got to say, what are the things that inhibit or modulate that? And that's largely that SIRT2 gene. And then we say, what resolves inflammation? What produces these resolving chemicals? That's things like fish oil, right? So all these things we'll start to learn, what roles do they play in quelling inflammation? And you'll have a better understanding when to use different things in different parts of inflammation. So inflammation, what are some of the big drivers? And some of you may be very aware of these, some of you may not, right? Blood sugar, things like diabetes, things like hypoglycemia, anything that alters blood sugar will increase inflammation. It will increase things like NF kappa B, TNF alpha. It will increase inflammasome production, chronic stress and overtraining, right? Especially during this time, a lot of people are working out, or a lot of people, will work out for stress. And I'm definitely one of them, right? Working out is beneficial, but sometimes when it's overdone, that can create more of a burden on the body. Chronic stress or overtraining, poor sleep. We'll talk about how sleep affects inflammation in the immune system. Environmental pollutants, so air quality, things like mold, things like plastics, things like that. Hollow space dysbiosis. This is a fancy word for issues in the gut, issues in the sinus, so chronic gut issues, chronic sinusitis or inflammation in the sinuses, allergies, things like that. And then anemias and hypoxia. Anything that robs the body of oxygen is going to increase inflammation. So these are the most common, and honestly, a lot of times the easiest things to fix. Blood sugar, really not too difficult to fix. It can take some work, but the mechanisms are pretty simple. Stress and overtraining. We all deal with stress, and stress can be difficult to manage, but there's a lot of tools, and there's a lot of tools that we offer at Integrated Health Systems to help with stress. Poor sleep. Once again, we have lots of tools to help individuals optimize their sleep, right? And then, we, as some of you may be aware, working on the gut and things like that can be a little bit more difficult. But the key is saying, how can I optimize each one of these arenas? And honestly, if you have stable blood sugar, your training's dialed in, and you have your stress managed, you're sleeping well, your gut's doing decent, your sinuses are issues, there's no issues, you don't have anemia, right? You're probably going to do pretty good, and your inflammation's probably going to be pretty low, right? Some different lab markers that some of you may be familiar with are things like CRP or C-reactive protein, things like homocysteine, ferritin, omega-3, 6, and 9 index. So once again, this looks at those different ratios to see, does someone need more omega-3s or omega-6s or omega-9s to help them resolve inflammation? Another thing called TGF-beta, which is an immune inflammatory marker. And then in regards to the gut, what's called calprotectin or IgA. These are immune markers of inflammation in the gut. So we can use all of these inputs to say, is there inflammation? What type of inflammation? Is it gut related? Is it sinus related? Is it iron related? Where is it coming from? So that we can truly get to the root, right? Because once we get to the root, that's what a lot of times certain supplements will be helpful in quelling that inflammation, right? But if an individual is diabetic, they don't sleep, they have chronic gut issues, they can take as much turmeric, as much resveratrol, as much omega-3s as they want. It's probably not going to do much until we resolve the underlying driving factors. So that is very, very key. If we look now, here's some research looking at hyperglycemia and inflammation. So once again, some of you who joined me a few weeks ago saw this slide. It's kind of a review, but we look at it. Increased or elevated blood sugar can increase intestinal permeability. So some of you have heard us talk about what's called leaky gut, right? So in your gut, you have a barrier system that is protecting your gut from the outside or from the inside world, right? It's keeping pathogens from getting in and disrupting the immune system. So the tighter and the better that barrier is, the better you can protect yourself from pathogens from the outside. And we see that elevated blood sugars inhibit that intestine from being very durable and makes it more permeable, right? This leads to an increased risk in microbial infection and inflammation. And this dysbiosis causes a polarization of the immune system from more of a Th1 to more of a Th2 system, right? And like I said, we talked heavily about this 2 weeks ago. For those of you who aren't aware, your Th1 system is really what helps you fight infections and quell that inflammation. In that Th2 system, it doesn't allow you to really fight infections, so it can allow pathogens to just linger and for there to be constant inflammation because your body is saying, hey, we're trying to kill this infection. We can't get rid of it. Let's throw more and more inflammation at it, right? And so sometimes driving that Th1 system and helping to actually eradicate that pathogen can actually be what slows down inflammation in the long run, right? So once again, blood sugar is very key when it comes to inflammation. Sleep. So once again, going back to sleep, we see that normal sleep patterns support more of a Th1 response. So more of a response that we want to balance, but right now with the current situation, the infection, we want a little bit stronger of a Th1 arm of our immune system, right? Sleep dysregulation causes alterations or polarizations in the immune system and creates it to become more imbalanced. So you don't get that inflammation and then anti-inflammation, right? When you have a balanced Th1 and Th2 system, you get that nice curve we are talking about. When you get that polarization from dysregulated sleep, you alter that curve and you're going to have a much more difficult time resolving infections and getting on top of them. We can also sleep disturbances can increase levels of NF-kappa B, STAT3, and interleukin 6. Once again, these are inflammatory markers that are signaling to infiltrate tissue with more and more immune cells because they think something's going on, right? So we can see that sleep is huge in driving imbalances in the immune system. So we can see that if we get sleep in check and then we use the right supplementation to then bring those levels down, that 1-2 combo is going to be very, very helpful to sleep. But once again, if one is not sleeping, you can throw all the supplements you want in the world. It's probably not going to make a huge difference. You have to do both of them, and you have to do them together. Okay? So let's talk a little bit more in depth about some of these things, right? We could spend, a lecture for, an hour on one of these things, but I want to kind of go through and give you a little bit of tactics that you can start doing on each one of these things. Okay? Chronic stress responses. This is where things like mindfulness techniques, meditation, those things can be very helpful. This is where Jacob, some of you may be familiar with, our counselor, Jacob Meyer, we love using him. He is great with mindful techniques. He's great with teaching breathing techniques and things like this. So that's kind of the large role he plays in our practice, is really helping individuals manage that stress response. The better one can manage their stress response, the lower their inflammation is going to be, the more durable their immune system is going to be. And it's so key during a time like this to have a very durable immune system. Different breathing techniques. Some of you may be familiar with these. And these things are, you can YouTube or Google. We can walk through real quickly, but really handy breathing techniques in shifting you from kind of that fight or flight to that rest and digest, and lowering some of that stress. So we have what's called box breathing. So box breathing is actually came from the Navy SEALs, and they use it a lot, and they use it in the military. But it consists of a 4-second inhale, followed by a 4-second hold, followed by a 4-second exhale, followed by a 4-second hold, right? And repeat it over and over again. So box breathing can be very helpful. What's called 4-7-8 breathing, which is in for 4, hold for 7, out for 8, right? This helps to slow down respiration and slow down breathing rate, which can help a lot with stress. And then we have what's called alternating nostril breathing, which is where you plug up one nostril, you breathe in through one nostril, hold, plug up that nostril, and then breathe out through the other. And you kind of alternate between nostrils. Those 3 tactics can be very helpful in managing and calming down stress. So once again, this is where I love to use Jacob and different breathing techniques. And from a supplement standpoint, this is where I love like adaptogenic herbs. So things like rhodiola, ashwagandha, holy basil. Those things are very helpful in controlling chronic stress and bringing stress down. So things like adaptogenic herbs indirectly can boost one's inflammation by calming down stress, which will bolster the immune system. So although it doesn't have a direct stimulating effect on the immune system, it has kind of an indirect via managing stress and managing inflammation. Okay, blood sugar. Really, when we look at blood sugar, the key in the game is improving what's called insulin sensitivity. So real briefly, the way insulin works is you eat a meal, you have receptors all over your body that are sensitive to insulin. So when you eat food, you release insulin. That helps open up the floodgates to allow you to bring sugar and food into cells so that you can get energy. The problem is if you have chronic exposure to high levels of blood sugar, that leads to higher levels of insulin, and your insulin receptors become less sensitive. So now you need more insulin, you need more food to get the energy you need, right? The more sensitive insulin receptors are, the easier it is for you to uptake food, right? And insulin is a very inflammatory molecule, so we don't want high levels of insulin. So what are some things we can do? Eating foods that give you stable blood sugar responses. Now, once again, I know this is kind of vague, and we could do a completely multiple day lecture on this. And if people are interested, let me know. We can do one more on how do you eat for blood sugar responses. But this is pretty much eating. Looks like someone, we have one person saying that sound cut out. Let me know if anyone else is getting sound that is cutting out. So we'll pause for a brief second. Everyone hop into the comment section or give me a thumbs up or a thumbs down if the sound is going out for any individuals. Okay, we have one thumbs up for sound. Another one, sounds good, sounds good. Cool, looks like sound. So Amy, let me know if the sound comes back. I'll see if I can fiddle. Looks like for most people the sound's doing pretty good. So I don't know if it's something. Oh, perfect. Looks like it's back in. Perfect. So going back to blood sugar, other things that activate what's called AMPK, which is an enzyme, can help with blood sugar. So there's a drug called metformin, and metformin is one of the top drugs that's used for diabetics. And largely, what this does is it stimulates something called AMPK. AMPK is the master enzyme in the liver to tell what are fuel sources. So think of it like a fuel gauge. It says, is fuel low? Is fuel high? Right. So when we have high levels of food or we have excess fuel, so we're eating all the time, this is going to inhibit our AMPK system. We have times of low food, this activates our AMPK system. This is why things like fasting, exercise in a fasted state, and then things like supplements like berberine that all stimulate AMPK are really important, because when AMPK is stimulated, it increases mitochondrial biogenesis, it decreases inflammation, it pretty much forces every cell in the body to work more efficiently, right? So we can find ways to stimulate that AMPK enzyme from here or there to really regulate and improve insulin sensitivity. Once again, I'm going to give you some takeaway things that you can do throughout your day that are pretty simple, that are free, and some supplements that can help stimulate that AMPK system that help to really stabilize blood sugar, improve insulin sensitivity, and then indirectly improve inflammation to bolster your immune system. Okay, so blood sugar is very, very important when it comes to immune function, right? And lastly, sleep, right? We talked about sleep is so important. And I did a handful of webinars on this a while back, and I may do another one soon, more in detail about how we kind of hack sleep. So if that's a topic people are interested in, leave a comment and we can do a future talk really going in depth about sleep and how to optimize sleep. But from a simple standpoint, I want you to think of sleep in a few ways. Largely, I want you to think about it from a standpoint of circadian rhythms, right? Sleep wake cycles. How does your brain know that it's daytime? How does your brain know it's nighttime? Because these rhythms help to set the tone for producing cortisol or things like melatonin. Cortisol wakes you up, melatonin puts you to sleep. One of the biggest things that helps with circadian rhythm is light exposure. Light is one of the main things that signals daytime, nighttime. So step one is optimizing light exposure. Some of these things are free and very simple. I tell everyone that, and this can be difficult at certain points in the year, depending when you have to wake up for work. But as soon as you wake up, if you can, the sooner you can get outside and get natural sunlight on your skin, in your eyes. Don't necessarily stare at the sun, but maybe go for a walk for a little bit without sunglasses, because all of those help to signal daytime. And the closer you can do that around the time you wake, the closer you'll start to notice your body waking up at that time, because you're starting to instill now's the time to produce cortisol. And you can even time that up with things like coffee and walking. So now you have sun, caffeine, a little bit of exercise, all signaling to say daytime produce cortisol, right? And then the key is at nighttime, we need to signal that it's nighttime, right? So we now need to limit our exposure to things like green light and blue light, right? This is where people talk about avoiding screens. One tactic I like, since it can be difficult to avoid screens, is what are called true dark glasses. And if you're a patient of mine, I might have suggested them too. But they're really great glasses, and they kind of look like Bono glasses. They're like a dark amber red. They help to cut out all blue light and green light frequencies that can inhibit melatonin. So from a visual standpoint, it almost mimics darkness, right? So you're still watching TV, you're still working on the computer, but it helps to signal darkness to your eyes and to your brain. So those two things alone can start signaling daytime, nighttime, daytime, nighttime. And sometimes those alone start to bring those circadian rhythms back online and significantly improve sleep, right? And indirectly lowering inflammation, right? So once again, another thing that can be done is signal morning and nighttime with timing of eating, right? So your first meal of the day can signal that it's daytime, and the last meal of the day can signal saying it's nighttime, about to go to bed. This is where I tell patients, usually try to eat your last meal within 2 to 3 hours of when you want to go to bed. So if you want to go to bed at 10, try to eat your last meal at 7, right? Once you eat that meal and then go a few hours without that meal, along with the limit in light, these two things help to say, okay, it's time to rest the intestines. It's time to move into more of a parasympathetic state and move into sleep. When we have individuals snacking late at night, this inhibits melatonin production, right? So now you have artificial blue light, snacking late at night. You have all of these things signaling as if it's daytime, right? And we want to signal nighttime. So timing of meals can be very, very important, right? Managing stress, of course, is important. Trying not to do any work while in bed, or even trying to stop work, at least a few hours before wanting to go to bed to limit stress, right? Certain supplements that I've seen to be very, very helpful, once again, every patient's completely different, is things like CBD, right? I find CBD to be very helpful in improving deep sleep, but also improving what is called sleep latency. So, time to fall asleep. How quickly do you fall asleep? Things like melatonin. I love melatonin, but I'd rather someone be able to produce their own melatonin, because we do know that a ton of exogenous or outside melatonin can impede your body's ability to produce your own melatonin, right? So, we want to do things to get your body to produce melatonin. Once again, I don't like to do supplementation with sleep until those first three things are optimized, right? If someone is still on their computer watching TV, on their phone until the point they want to fall asleep, and they're snacking on food and sugar up to that point, supplements aren't going to do much, and supplements aren't really fixing the problem. So I always start with resetting circadian rhythms, and then if we need supplements, we can add those in. And a lot of times they work so much better once we've optimized those other aspects of sleep. Okay. So to kind of review, right? So we have things like TNF alpha, NF kappa B that cause immune cells to rush into tissue, right? Some things that can inhibit this are curcumin, which is from turmeric, resveratrol, which is from our all-time favorite, red wine. But I would suggest wine is not the best source of resveratrol. Trust me, I'm very sad about that. And things like vitamin A, right? So those help to inhibit the immune signal that's rushing more immune cells into the tissue, right? So that's one mechanism of stopping inflammation. Okay. Immune cells must release chemicals to resolve inflammation. This is where omega 3s come into play. So fish oil. And then inflammasome production. Remember, this is where we talked about we have to activate that sirtuin gene. So what are some sirtuin activating compounds? Things like resveratrol, things like quercetin, things like berberine, things like nicotinamide riboside or nicotinamide mononucleotide or NAD. I know those might have been some big words, but things like NR, NMN, or NAD. Once again, some of my patients I have on certain supplements, NR and NMN are precursor to what's called NAD. Think of, once again, NAD as a huge driver of energy in cells, right? But NAD is actually necessary to activate sirtuin genes, right? So actually, resveratrol in NAD, and there's a researcher out there by the name of David Sinclair out of Harvard, where a majority of his research is on NAD and resveratrol and how it activates that sirtuin gene, right? So NAD is the fuel that the sirtuin gene needs, and resveratrol is what helps activate it to go, right? So those two actually are a 1-2 combo that work really well. And the way they work with inflammation is they stop that inflammasome production, right? Where things like calorie restriction, or what I like more is intermittent fasting, sometimes extended fasting, but this is largely where fasting can play a role, and then exercise, and more specifically, exercising in somewhat of a fasted state. And we'll talk about this a little bit in a second, is not doing a crazy CrossFit workout in a fasted state, but something very light, maybe like a walk, a light jog, a light cycle on a bike, something that gets your heart rate up, but not too much, right? That in a fasted state, there's a lot of good research actually shows that it can signal that AMPK pathway and that sirtuin, decreasing inflammation. Okay. So what does an optimal day look like? So what I'm going to give you is roughly kind of what I shoot to do largely in a lot of my days, or what I try to make my day look like roughly, right? And this is something that I've taken from different people in different lines of healthcare, or I've taken some of the thoughts that we've talked about and say, how can I make my entire day be focused towards tasks and things that are lowering inflammation, right? So step one, sleep. Making sure sleep is optimal, right? And when I'm waking up, I wake up, take my dog for a walk, maybe a 10, 15-minute walk. So right off the bat, I'm getting light. I'm getting sun exposure to say it's daytime. Honestly, at that point, I'm in a fasted state for probably already up to 12 hours. So now I'm getting a little bit of a mild fasted workout where, I'm doing about a mile and a half walk in a fasted state. So not a very intense exercise, but a light little bit of aerobic exercise in a fasted state, and at the same time, I'm signaling it's daytime. Right. So if we look at one, optimize sleep. Two, eating in some sort of time restricted window. So intermittent fasting. So either eating in a 12-hour window all the way up to a 16-hour window. So this could be you eat dinner at 8 and you eat breakfast at 8, right? A lot of us probably already do that. And if you do okay with that, you can start narrowing in the window more and more. But I really think for most, you don't need to go beyond that 16-hour window, especially for females. Females don't tend to do as well with intermittent fasting as males, and this can be because of hormone issues. So things like estrogen and progesterone, but also thyroid hormone can be affected. Men tend to do a little bit better with intermittent fasting, but that intermittent fasting helps to activate that sirtuin gene, which inhibits inflammasome production and increases NAD. So you see, you got a nice 1-2 combo there of decreasing inflammation, right? And then we talked about a mild fasted workout. This could be yoga, walking, slow jog, sauna session, right? Once again, this activates that sirtuin gene in that AMPK pathway so that you are stabilizing blood sugar, you're increasing mitochondria production, and you're activating the sirtuin gene to then decrease inflammation, right? So you're attacking inflammation in 3 different ways in just a mild fasted workout, right? And I usually do that in the morning, and I save my harder workouts for the evening after work that are more strength-based, higher intensity, because I want to be fueled for those, right? I don't want to do them in a fasted state because that can cause too much inflammation or too much stress. Once again, we want to use workout to make us better and healthier. We don't want to use workouts to trash our body even more and break us down even more, right? Cold exposure. We didn't talk about that much in the presentation, but cold exposure can be amazing for inflammation. Once again, similar to working out, it's a stressful signal that helps to make us more durable. One other thing I want you to think about is we want to understand signaling pathways and receptors, and we want to know how to amplify them. And this is why I stack a lot of things together. And if we stack more and more things together, we can amplify a signal that we want to achieve. That's why, a light fasted workout in the sun, you are stacking multiple things together that are all signaling the same pathways in the hope that you can really ramp up the signal from that pathway to get the desired benefit, right? So cold exposure, once again, is very, very helpful in lowering blood sugar, stabilizing blood sugar, but activating what's called heat shock proteins, which are pretty much just, it's a signal that you're in a really stressful environment, right? And this helps to lower inflammation. Now, once again, this can be overdone. Too much cold exposure can make things even worse, right? So it's important to do brief bouts. And this is where a lot of times after my fasted walk in the morning, I'll take a 1 to 2 minute cold shower. So I'll hop in the shower, I'll rinse up, and I'll finish on cold, right? So I'm getting this brief exposure to cold to stimulate my immune system. Or you could do a cold plunge. So some people have cold pools, different things like that. Honestly, in the winter, sometimes I'll just take my walk in the morning in like a t-shirt and shorts. And a lot of people in my apartment complex probably think I'm crazy walking my dog in shorts and a t-shirt when it's snowing. But my thought is, right, I'm in a fasted state. I'm outside. I'm moving. I'm getting sun exposure. I'm getting cold exposure. I'm getting all of these signals to stimulate these pathways to lower inflammation. So once again, I'm not telling everyone to go outside. Oh, my doctor told me to go walk around in sandals in the cold. Find what works for you of some sort of cold exposure or get cold, right? Get uncomfortable every day, right? That's also largely part of it is if things are comfortable and easy through every day, right? They don't stimulate resilience or your body's ability to adapt and get stronger, right? So we got to find ways to stress it. Intermittent fasting stresses it. Fasted workout stresses it. Cold exposure stresses it, right? And then the last 2 things is eating a good quality diet that works for you, right? A whole foods diet. I don't want to get super into diets here, everything from paleo diet, autoimmune paleo diet, keto, what's good. Like I said, that could be a whole weekend lecture. And if people want to talk about that, we can. But, eating a clean diet is going to be really, really important. And then appropriate supplementation, right? So what does supplementation look like? And these are some things that I take daily, right? So from stress, adaptogenic herbs, breathing techniques, mindful techniques. So maybe while you're on your walk in the morning, you're doing breathing, or you're doing a meditation, or maybe if you're sitting in the sauna at the gym, you are doing some sort of breathing technique, mindfulness. Things like fish oil to help resolve inflammatory responses. Things like curcumin, resveratrol, and vitamin A to inhibit inflammatory signals. And then things like resveratrol, quercetin, berberine, calorie restriction, and exercise to decrease the production of inflammasomes or decrease inflammation from even happening in the first place, right? So now you have an idea of what are some tactics I can start adding into my life. And honestly, a lot of them are free. A lot of them don't cost any money. And that's what I wanted to do, is give you tactics that you could apply, right? And you don't have to spend an arm or leg to do, right? And then once you start mastering some of those tactics, you start adding in some of these supplements and really start optimizing your day. And honestly, make your day work for you, right? Don't have your day be something that's wearing you down, making you more inflamed. Have your day and have your focus be on making your day focused around making you more durable and stronger, so that you come out of each day less inflamed and as a stronger human being and having a stronger immune system. That's my big goal with the talk tonight. And I hope that I empower you guys to start taking some of this knowledge and start implementing it into your everyday life. Okay. So the keys I want to kind of finish up with is act sooner rather than later. Now is the time to take control of your health. Not when you're sick, not when you have, heart disease, diabetes, or more serious conditions, or you're getting ill with an infection. Start now. Start now before maybe it's too late, right? Things can be done, right? And going back to that, I know I said until it's too late, at the same time, things are never too late. Even if you do have things like diabetes, heart disease, that doesn't mean there's nothing you can do. That just means you got to get started even sooner than someone else, right? So things can always be done. The body is a beautiful thing. It can adapt, it can heal. So the big things I want to leave you with is act now, right? And that it's never too late. And then the other big thing is that we offer free consultations, right? So if you're not a patient of ours and you're kind of curious a little bit more about the things we do, or can we help with your condition, give us a call. We'd love to help. In a second, I'll give you the phone number um, that you can use to call the office to set up a free consultation where I can sit down with you. We spend 30 minutes and we just go over your case and we decide what would be the right thing for you moving forward. Right. And if there's any current patients on here who are saying, hey, I have some more questions about inflammation. I want to see, I want to create, a customized protocol with exercise, with diet, with timing of things and things like that. Call and set up an appointment. We can talk about that as well, right? So this is for active patients and then people who aren't patients, right? To help really dial those things in. So those are the three things that I want to really leave you with, right? And I want to let everyone know that we're trying to put out as much content, as much information. Myself, Dr. Stedman, and Jacob are on the radio once a week, so we alternate, but it's Mondays at 12:30, and we are on Haystack Radio. So you can see right here, KLZ, the source, and it's 560 AM or 100.7 FM. So we're always kind of talking about things, going over different topics, everything from concussions to inflammation to discussing upcoming webinars. So you can find us on that. You can follow me on my Instagram or my Facebook, which is dr.perry.maynard. And I'm posting videos and I'm posting content on my social media platform. So I'd love to have you follow me on that. So follow us on all these things so you can kind of see the things we're doing. We'll be doing webinars weekly for a while, trying to give you guys content. And if there's more topics you want to see or you'd love to hear, please let me know. Let us know. Call the office and say, I'd really love to hear more about this, or I'd love to hear another lecture on this. Right? I'm creating this content for you guys, right? So I want to make sure that it's things that you guys want to hear. Okay. And then the important thing is, during this time, right, a lot of offices are closed. We are offering telehealth, right? So we are not completely closed during this health crisis. We're still doing a lot virtually. And honestly, a lot of the different things we talked about with inflammation, those can be done virtually, right? You don't need to necessarily be in the office, although we love to have you in there so we can examine, right? We can review lab work over the phone. We can discuss diet. We can create meal plans, supplement protocols, workout protocols, all these things via telehealth, right? So it's a really cool thing that we offer during this time, as we work through this virus and things like that. So telehealth is available, and you can contact us via 303-781-5617, and you can talk with either Lindsay, who is our awesome front desk staff, or Sandy as well. Both of them are amazing and can help you out and get a consult set up or help guide you with any questions and things like that. So I want to thank everyone so much for coming out. I hope you all took something from this and you have something to implement tomorrow morning to start taking control of your health. Um, I'll kind of open this up for any questions that people have, and then we'll wrap it up so everyone can be with their families and have a great evening. So if anyone has any questions, please just put them in the chat box, and I can answer those for you. Okay. So if there are no questions, then we'll kind of wrap things up. Like I said, if you kind of tonight you have some questions, give them a call. Like I said, we can always chat via a free consult, and I can answer questions then as well. So once again, thank you so much, everyone, for coming out. I hope everyone has a great weekend. Take care of yourself. Enjoy your family. Now is a time to really appreciate the things that we're grateful for. So family, friends, loved ones, our health. I wanted to say a big shout out to all healthcare providers working in the front line. If anyone on here, is a nurse or a doctor in the hospital or anything like that, I have a lot of close friends, and my girlfriend works with COVID patients. So I'm very appreciative of everyone out there fighting this fight and taking care of people. So if you or a loved one is in that front line, thank you so much for the service and the things you're doing. Thank you for coming out, and I'll see you guys in a few weeks for the next one. Have a great night.